she's just saying, what could we do better? And is it the collective we? Is it Adirondack Foundation? What are you thinking, Holly?
I was thinking of it as the foundation or the BT3 community. We've done so many things. What's the greatest challenge next? Or is it just doing more of the same? But what could we do better? What do the providers need the most?
Rose?
Ah,
I was hoping no one turned that back to me.
I think Rose can probably answer that very well.
I'm sure you have a bit to say, Barb.
No, I don't actually.
Well, it's all directed back at funding, but what we really need is consistent, reliable funding. As much as grants and periodic assistance, all of those things are very helpful, but I'm going to get developmental terms on us right now, but if we think about Maslow's hierarchy of needs, right? When you start talking about those individual grants, they help you reach the highest level. They help you reach self-actualization. That's wonderful. But when we look at the bottom of the pyramid, we're looking at need, survival-based need. And when you are concerned about your day-to-day or what might affect you next, the consistent support is essential. We, just as an example, one childcare spot is worth easily around $9,000 a year. And one child not being in our program, one child dropping out, one child during the pandemic is $9,000. Now you look at, restrictions and everything we're facing on a day-to-day basis, 2 children, 3 children, that becomes 4 children, that becomes a staff salary. It starts eating into your salary as well. You start taking the cuts, which is pretty common, Barb, right? In early childhood that we take the cuts first.
Yes,
It's the benefits, it's the things that make people stay, and then you have turnover, and then you have to find new people or let people go. And every time you restart, your quality of programming goes down drastically because you have to invest in retraining new people, and staff turnover is a large problem, and the pool is getting smaller and smaller. And all of those issues could change if we had regular subsidized federal support that we could rely on based on region, number, capacity, whatever it may be, support to reduce the amount of tuition parents are private paying. So you have to imagine a majority of people are private pay. And yes, there may be subsidies for low-income families, but you have to imagine from our perspective, they do not pay the amount that your spot is worth. They pay what they think it's worth for your region. And they also pay after you've already provided care with a delay. So we have to front the costs. We have to reduce the cost of that spot for subsidized care, which we do because we believe all children should have equal access to care, whether or not the price of that is paid for, but it all comes at a cost. So can you afford, 4 weeks of several children's tuition to post up front while you wait for reimbursement from the county? That's not reliable either. So I'd say funding that is not based upon income in such a way that it leaves so many out.
Thank
A
you.
lot of working families can't make ends meet either, and they are routinely left out of that need. So, am I good, Barb? Did I do a good job? Did I make you proud? Barb is my mentor. I love her.
I love you, Rose.
Robin, would you add anything to that? What do you need? How can the foundation support you?
I think she covered it exactly. She did a good job.
Great. Thanks, Rose. Are there other questions out there? You could just ask one provider. We don't have to have everyone answer. You could ask a broad question. Yeah, Craig. Oh, you just muted.
How big is the universe of providers? If you took the park, for example, you made a statement that there were 5 or 6 kids for every slot available. I was just wondering how how big is the provider universe that we're trying to help, or trying to be helpful to?
It's shrinking.
Is it shrinking?
It's shrinking. I'm retiring next year after 40 years. Many in the last few years are done. They retired. You get young parents that come into this business because they want to be home with their babies. And then when their babies go to school, they get out of this business. If they make it that long, this is not an easy business to be in. It's hard on your home as well. But I think it's shrinking. I just think that there's not enough people willing to come into it anymore. There should be incentives to get people to do this, because there's a big need for it. But I feel it's certainly in Saranac Lake, family childcare is shrinking. There's only a few of us left in Saranac Lake. There's still 3 centers, but and Rose's preschool, but family childcare on my street, on the street behind me was a family childcare, down the street was a family childcare, on the other street was, and we would meet at the park with our kids. And now there's only a few of us in Saranac Lake. In Franklin County, Saranac is divided with Essex as well, but I know,
Good.
talking to Ian not long ago, that we need to find a way to entice people to get into this business, or we're going to lose family childcare.
If I can add to that, I do a lot of work with the Child Care Council, and they have some pretty startling specific numbers. They keep tabs on all of these things. So you can see some pretty informative numbers from them. I think 2019, they had just come up with the most recent data on that. And it's charted out with how many providers are leaving our area and how many are reopening. And I can't remember what it was. I wish there were only 2 new providers that were looking to open but had not actually done so. And I think upward of 8 or 9 that were leaving, projected to leave.
Wow.
So don't quote me on the exact numbers. I'm trying to remember it now, but it was substantial. And I very much encourage you to look into it because it's easy to attain and it's the most informative information we have, and it's quality data.
I saw Bob
you.
pulling out a report. I wonder if I'm putting you on the spot or if you have those numbers.
Yeah, I have some numbers. I never have the exactly right numbers when I want them, but they're in, I'd say 2018, we did a data report, Beta 3 did a data report, and at that time there were 3,800 regulated slots in the 3 counties, Clinton, Essex, and Franklin. We're about to update that report and include Hamilton and Northern Warren counties. So there'll be a new report coming out relatively soon. Off the top of my head, I remember like 375 programs, but you know, what they've said is right. There's a lot of people getting out of the business. So there's a real crisis. And that actually, if it's okay, I'll take that as the lead into my question. Because, you know, quite honestly, you know, I've been an early childhood policy analyst for a long time. And I've felt that for a long time we needed a crisis for people to begin to realize that our childcare system just isn't working. Other countries, I think Holly raised a question about what do other countries do. Other countries fund early childhood education and fund it well, and people get paid well, and there's family leave and so forth and so on. It's, you know, it's only here where we don't provide healthcare and we don't provide childcare. But so the crisis may be here. You know, the pandemic has created a tremendous crisis on childcare. And right now, the governor has created a task force on reimagining K-12 education. Let's pretend for a minute that he decides to do something like that for early childhood education. I wonder, maybe Barb, you can answer this. What would, if we were going to reimagine how the system worked, you know, how would you, what would you like to see?
For promoting more high quality childcare.
Yeah.
I had 2 thoughts, and Rose already addressed one, which would be like family salaries be subsidy eligible. Very, very important for that. We all accept it. And it's not cheap anymore to go to, if you have 2 children in childcare, you're paying up to $400 a week. For a middle-class family, that's a lot. The other thing that I can only think of is there should be some incentive for providers to better themselves with CDA, NAFIC accreditation, Quality Stars, college courses. A lot of providers are young mothers and don't want to be away from their family. It's hard to even get them to come to a training in the evening. But if there were incentives, there's no incentives at all. OCFS does nothing for us about, wow, you've done 70 hours of training this year. Whoa. I mean, that's a provider who's trying to stay on top of child development, trying to learn many new things, and all of that education improves their quality of their care. And I just have always thought there should be some sort of incentive to, I don't even know what it would be, but even acknowledgement from OCFS, and not a mass letter to every provider, but when you have a provider going the extra step to get credentials, you know that they've improved their program, they've improved their understanding of child development, the families are happy, the children are happy, they have a great reputation. There should be something done that acknowledges that for them, and that will make them want to continue to do that. That's why they get in it and they get out of it. There's no incentive. And when you do all those trainings and then have the licensor say, we don't want to know about those trainings, we just want your bare minimum. Well, okay, why am I doing all these trainings? For some of us, it's because we want to be professional, but I just think you need to entice providers into doing more, and they would gladly do it if it was some sort of incentive offered to them, because they'll get better, the kids will get better care. That's all I could come up with.
Can I share that I actually found the infographic for 2019? I actually have the information. If
For the number of childcare providers?
yes.
Oh, screen share. Rose, you're so
I know. Woo, fancy.
You, Rose.
I know I've been practicing, but you can see the numbers right here. How many spots and what the capacity is and how many regulated childcare providers, but we're losing childcare programs. So 2 new programs open, but 12 closed. So, and this is just the 2019, who knows what the 2020 numbers are. But if you see here, all the information, how many children are living at or below the poverty level, you know, how many programs with Quality Stars, just over 19%. So I thought that would be a nice thing to share, and I knew I had it saved, so I felt uniquely prepared, but there's nothing, you know, when you look at these numbers, it becomes very, very clear what's going on.
Yeah, I can send out
Lindsay?
the childcare desert report that has
Great.
this infographic for each county. So
Thank you.
Rose
That's
is
my
showing
question.
is Franklin
I'm-
County.
Yep. I do
But
actually.
the
I actually
childcare
have that.
report has each of the counties, and it changes, like Rose said, you know, this is our most current infographic, but those numbers are changing. What were you saying, Craig? Sorry.
No, that was my question. Could you send it out? So thank you very much.
Did I miss other hands when I asked? Are there other questions that folks have? I would say in the room, but in the
Lindsay, so in before and after school care, you know, where I work in New Jersey, there's a statewide organization, and it's all, you know, childcare before and after school providers. So are you guys, you know, so Rose, you said there's a couple, you know, of preschools. Barb says there's a few families, you know, and Robin said the same thing. Are you all on your own in a desert, or is Birth to Three sort of the place that you can come together and find other providers? Are there other ways that you see each other or share information?
We are all friends, aren't we, Rose? Are we friends, Rose?
Yeah.
I think in Saranac Lake, I know that we are all friends. We all know each other. We've known each other for years. We meet each other at trainings, and Lindsay can tell you what happens at trainings. We get together and start chatting, and everybody gets off topic because we haven't seen each other in 2 months, and So we're all pretty friendly, don't you think, Rose? We all help each
Yeah.
other if we need it.
Who
Um,
would who would be giving the trainings, for example? What organization?
The Child Care Council for us, yeah.
Mhm.
Sometimes Quality Stars.
Yeah.
The union voice gives trainings sometimes.
So to kind of feed off that answer, you know, we were kind of all, we needed to find each other before we had organizations like Birth to Three.
Yeah.
And we were very fortunate that a number of us came together and did that, because doing this alone is, honestly, it's impossible. You can't do it isolated. You need other providers to have information. Before Birth to Three, I will say communication was not New York State's strong suit in getting us the information we needed or knowledge about the programs that we have access to or resources. Birth to Three does that. It does it well. Quality Stars also does an exceptional job. Unfortunately, we also have the Child Care Council, but it fills in a lot of holes that existed for a long time. We did not have resources. That's a more recent thing. There may have been a general presence beginning, you know, in the last 5-10 years, right, Barb? But really, the last 5 years solidly have been the biggest presence we've seen for organizations like Birth to Three. For us, we're very fortunate to have them because they're extremely present in our communities. So that is a huge resource and connects us with other realms of early childhood that we did not have access to before. So we've been connected with the school districts locally as well, because yes, Birth to Three, it sounds like it's just infant through age 3, but Birth to Three recognizes that it's the foundation for everything afterwards. And they're routinely involved in every stage of development. They're looking at the longevity. They're looking at how children are doing transitioning into kindergarten. They're looking at all of these things and supporting them. So connections we didn't previously have were forged through Birth to Three.
Thanks.
Thanks,
Well
Rose.
said,